and we'll go ahead and get started with our slides and today's presentation. So thank you so much for joining us. My name is Julie Babbage, and I'm the Executive Director of the Diabetes Patient Advocacy Coalition. Welcome to the Michigan Diabetes Advocacy Forum. I'm coming to you live from Kentucky today, but I do have to say a quick go blue because my uncles played football at Michigan. So hopefully that isn't upsetting to anybody on the call, but we're excited to have you with us today to talk diabetes and specifically what the key issues are and in your state capital, how to make changes and how to advocate with Deepak. Deepak advocates on behalf of families, people with diabetes, and based on your registration, we know that we have a pretty even split across the spectrum, type 1, type 2, parents of children, caregivers, and others. And also in your registration, 71% of you indicated that you have never met with an elected official until today, that is, because on our agenda, we are really excited to have and welcome Representative Cambisi and Senator Daly with us, who will speak in just a few minutes. So we'll show our agenda here to you, and we will transition after that into how to be a diabetes advocate and Deepak Champion, as well as hot topics in diabetes advocacy in Michigan specifically and around the nation. Moving into housekeeping items, if you have any questions for us or the panelists, please submit them at any time. And today's meeting is being recorded here and on Facebook Live, and we'll send that link out after the meeting. A quick note on Deepak. I mentioned we're working on behalf of all people with diabetes, and our mission is solely advocacy. That includes state work and federal work, anything that is making meaningful change in law or regulation so that people with diabetes can live long, healthy, productive lives. And Deepak formed because it was evident that lawmakers were not hearing from the patient community when they were making decisions that impact people with diabetes. So our work is focused on making it easy to advocate for yourself and family on diabetes issues. We have events like today and resources to educate and empower people with diabetes. We also have what we call Click Advocacy, which is our platform, and it allows you to send a letter with just the click of a button to lawmakers and health leaders on key issues. So this makes it possible to share your story with government leaders who really need to hear from people with diabetes when making decisions. Next slide, we are affiliated with the Diabetes Leadership Council, which is the policy side of things to our advocacy-oriented organization. DLC works on how bills are written, their impact, they help educate lawmakers, while Deepak brings together more of the patient community to speak up and speak out on those issues. And both of us partner with diabetes organizations to build consensus on action that needs to be taken for diabetes. Just quickly on statistics, diabetes is of course prevalent across America, and Michigan is no different. You can see here some Medicare data that's indicating as well regionally where rates of diabetes are higher. Over 11% of adults have diagnosed diabetes in Michigan, and many more have pre-diabetes or are undiagnosed or are children with diabetes. So that gets us into our policy discussion and why we're here today. We've got a visual to show you the bills that are active in state legislatures and where Michigan stands on them. Many states have filed these bills, are working on these bills, have passed these bills. This is legislation that Deepak actively supports, and we will expand later on this, but the main point here is that Michigan has a lot of open boxes and a chance to make some really significant strides in the legislation that they've passed for diabetes. And the good news is, even though not all of these boxes are checked, some of them are in the works right now. So we'll let our legislators touch on a couple of those, specifically the copay cap and emergency access to insulin. And with that, I will go ahead and get us rolling on our first panel and introduce our moderator, Ed Hawthorne. Everyone can turn on their cameras. Ed Hawthorne is the vice chair of Deepak's affiliate organization, the Diabetes Leadership Council. He is a former chair of the board for the American Diabetes Association and has served on several other boards, including the Red Cross and March of Dimes. He is currently the COO and managing director and partner of CE3 Solutions. Ed has been active in diabetes advocacy for decades, including the state of California, where he resides with his family. So thanks so much, Ed, for joining us today. And I will turn it over to you to introduce our panelists.
All right, well, thanks a lot, Julie. And we are excited to be in Michigan because as the scorecard indicated, we have plenty of opportunities to legislatively make a difference. For today's panel, we're so grateful and honored to have with us two individuals from the state legislature who are working to make some of those important opportunities a reality for people with diabetes. They both are primary sponsors on key bills supporting access and affordability, including the insulin copay cap and emergency access to insulin bill. Now, I'd like to introduce them to you today, starting with Representative Sarah Cambisi. So,
Hi.
How are you?
I'm doing great. Thanks for having us.
Well, we're so glad to have you here. And as I understand it, you're in your second full term representing Michigan's 109th House District, located in the Upper Peninsula. That you are a member of two committees and serves as a Democratic Vice Chair of the Commerce and Tourism Committee.
Yes.
And you earned your bachelor's degree in education and your MPA from Northern Michigan University. And before serving in the legislature, Representative Cambisi worked for Marquette Public Schools as Director of Adult Education, in addition to serving as a Marquette City Commissioner from 2012 to 2017. So now I'd like to introduce Senator Kevin Daly. And Senator Kevin Daly represents Michigan's 31st Senate District alongside the Western branch of Lake Huron. Currently in his first term as senator, Daly sits on several committees, including as chairman of the Agriculture Committee. And prior to his election to the Senate, his career in public service included positions of trustee, treasurer, and township supervisor for his hometown of Arcadia. He has also served the 81st House District from 2008 to 2014 outside of Lansing. Senator Daly works on his 5th generation family farm. So welcome and thank you both for joining us today. We're so excited to have you both. And of course, you know that the lead question I'm going to ask, because everyone has a connection with diabetes. And so we really want you to tell us your story and why you work on this issue that's so critical for so many people. And so we'll start with you, Representative Cambisi.
Well, thank you. And, you know, one of my biggest accomplishments, sometimes I don't get to talk about, is that I'm a 34-year type 1 diabetic who is living and thriving because I've always had access to great health insurance, but I've also had state-of-the-art access to state-of-the-art equipment like insulin pumps, glucose sensors. I've never had to go without or ration my own insulin. And for 34 years to not have any complications and to do things like run for a state office, get elected. I mean, these are things that if we just make sure that all diabetics have access to insulin that's affordable, access to health plans where they can get that one-on-one care with a dietitian, with a diabetes educator, that they have a primary physician that they can go see. We are not going to spend all of this money at the end of life for a lot of patients that never had this treatment going through and aren't able to manage their diabetes. So for me, it's very personal. The House bill I introduced last session when Colorado was the first state to introduce a copay cap on insulin. And I have watched insulin go from $20 a vial in the late 90s up to, you know, $600+ right now for some of those major name brand, you know, insulins we have. And for me, this is one of the most important things and issues that we need to work on with diabetes, is just putting that cap on there so that it's affordable.
Great. Well, thank you so much. And I know that you're able to speak to some of the issues that we're going to talk about today from firsthand. So thank you.
Yes.
Thank you. And Senator Daly, what about you?
Yes, well, and thank you. I want to apologize first off. I was hoping to have my computer. I'm on the road today, as you can tell. So I'm using my phone. I left my computer and and trying to do this from my phone. So hopefully it works out all right. But can you hear me all right, Ed?
Yes, we can. Thank you.
Okay, great. Well, and I don't have a personal story to tell about diabetes. Diabetes did run in my family, older onset diabetes. My father had diabetes, and I have an older brother that is a diabetic at this point in time. So, but what really got me involved in this was the legislation that we're going to talk about and its constituents in my district. So we can talk about that as we go forward, I think.
Great. Well, thank you so much. Both of you have sponsored legislation which promoted access and affordability for people with diabetes in various ways. And Representative Cambisi, as primary sponsor of HB 4346, the copay cap bill. I know you were talking a little bit about that earlier. So could you tell us a little bit more about the bill and where it is in the legislative process right now?
Sure. Unlike last term, I reintroduced the bill this session. It had a hearing over on the House, and it passed out of committee and passed on the floor with a wide margin of support. And I'm drawing a blank on the numbers, but over 3/4 of our chamber supported my bill. And I think, as Senator Daly mentioned, in Michigan or even nationwide, we know that 10% of the population are diabetics, whether they're type 2 or type 1. And that is a huge margin of people that are dependent on being able to afford their medication, being able to have access to quality health care. And so you don't need to have diabetes like me to have this bill to really understand and hear from your constituents that there are some problems out there. And when you see a medication skyrocket, a medication that, again, at the turn of the last century was founded and, given, they sold the patent for $1 because they knew how important it was for this medication to get out there to people and to have them afford it and have access to it. It's just wrong to see what's happening with it. And so whether you have diabetes or not, all of us hear that. And, my bill right now passed the House. We are awaiting a hearing in the Senate. And, I'm glad your group is out there and wanting to help us advocate for this, because we need all the help we can get. We're working closely with the American Diabetes Association, but we would love to have your group come on and help us get this passed, because I believe right now there are almost 20 states that have passed this same law where they cap insulin. And, you hear the argument that, it's going to raise everyone's premiums. It's going to cause small businesses to not hire or lay off people or give them less hours. The actuarials that we have seen from these other states that have had these laws for the insulin cap in place for at least a year or two, their actuarials say that there's a de minimis or basically no effect on the premiums of other people. And so it makes you kind of wonder, why the large increase, where that money is going, and how do we get a handle on this? Because in the interim, people are getting sick, and in severe cases, people are dying. And it's a situation where, again, Minnesota, Colorado, other states are stepping up and really trying to solve this problem and get legislation like this passed.
Well, I tell you, on the phone call with us today is our army of advocates. And so I think we're so glad that you're asking us for help. And I know that we are willing to give it, because it is definitely the right thing to do.
Yeah. And I can just say that, my mom, who's almost 80, she still worries about me. Even though I'm in my mid 40s, she still is a fierce advocate for diabetics. She was an RN. So I know that your volunteers out there, I know their passion. I know that they have either a loved one or a son and daughter or close family friend that they've joined this group for a specific reason. So I just wanted to say thank you to all of you who are with us today, because we need your help, and your role is vital to getting this done.
All right, well, thank you. And Senator Daly, your two bills, SB 155 and SB 156, were just signed into law earlier this summer. Could you speak to how they can help people with diabetes?
Sure. And for those that are familiar with Howdy's law, which was Kevin Howdy was an individual from Ohio that broke one of his bottles of insulin on a holiday weekend, a long holiday weekend. So he proceeded to attempt to, couldn't get a hold of his doctor, obviously, couldn't get a hold of anywhere to get more insulin. So he rationed his insulin and he was not successful and he passed away through the process. So that's kind of what started this just a couple of years ago across the country. I think there's 20 some states that now have this law. So we were fortunate. I was approached by some individuals within my district at what we call office. And they were both type 1 diabetics, both using pumps, both dependent on it, and we're very adamantly supporting this type of legislation. So, you know, what this does is it allows pharmacists to dispense an emergency insulin packet or a 30-day supply of emergency insulin if the patient has had a regular relationship with that pharmacy and they're familiar with them and they know that they've been reaching it. And then that's Senate Bill 156 would require that. And then, or excuse me, Senate Bill 155 and Senate Bill 156 would require insurance companies to cover the cost of that insulin as well. So those, it's very important to those folks. It was interesting because when we had the hearing, Tammy Martin is one of the individuals and she was really the spearheader of this. And she was sitting in the hearing when her beeper went off on her little thing that her sugar was out of line. So it was kind of appropriate because it really brought a new light to me, to my mind, because I didn't realize. But these two ladies really worked hard to work along with me, and we were very glad to see these bills signed into law.
Oh, great. Well, thank you so much for all that you do and all that I know you will continue to do for people with diabetes. We also believe that diabetes should be and is a nonpartisan issue, and the support for Senator Daly's emergency insulin bill is proof of that. Now, as you work to get these bills passed, how do you find common ground on issues of diabetes with your other colleagues?
You know, this was a really easy one to do, to be honest with you, because this actually passed. I believe it was 100% supported in the Senate. We had every one of the 38 senators supported it. I believe there was only one opposing vote in the House. And I'm not exactly sure the reason for that. But for the most part, this was a bill that just is good common sense. It's good legislation. It's legislation that should be easy to pass. And I find, and I know that Representative Cambisi is this way too. We work well together. We've worked rather together on other issues as well. For the most part, the majority of the legislators do want to work together. They want to work on issues that are important to their people. I mean, diabetics doesn't only pick on one party or the other. Diabetes picks on everybody. And so these type of things are things that we really need to work together on. And I think that, you know, I think this was an easy bill to pass because of that.
Great, thank you.
Yeah.
Representative Cambisi, is there anything you'd like to add?
Well, I'd just say that, you know, when you work together, I think a lot of what you see in the media isn't really, you know, what it's really like between the two parties or between the two chambers or two individuals. And so, you know, you spend a lot of time together, whether it's working on this bill or any other bill, and you form relationships. And that really is the trust building, is when you know each other and you want to help. You're willing to listen. You have an open mind. And the vast majority, I would say, of legislators that serve in the state, in Michigan, are really like that. And so you might have some, for whatever reason, might not want to join on or might want something changed slightly in the bill if that would make them support it. But overall, if you do the work and, you know, like Senator Daly said, when you have advocates that come from your own community, and there is a large percentage of the population that has the same issue, it becomes a lot easier. But the work leading up to that really is how well that legislators can work together and be open-minded and want to get stuff done.
Well, you are both models of that work, and it's encouraging to see sort of the success of the work that you guys have done and continue to do. So thank you so much.
Thank you.
The next question is that it has been well reported by now that COVID has had a disproportionate impact on certain segments of the population in the state across the country as well. And we generally call this health inequity. And it's great to get both of your perspectives on this, given your diverse geography in the state. And so how are leaders working to address this issue in Michigan?
Oh, yeah, it's a tough one because I think that the commonality that the UP has always shared with kind of our epicenter, which is the Detroit area, is that we're both kind of the underdogs, and we both have kind of an attitude that we don't quite trust government. And, this is something that when it comes to a pandemic and it comes to making sure there's access to those vaccinations and that people actually trust us, this was a big challenge. And it's something that you want to have the time to work up to it. And in a pandemic, we just didn't have that. So despite one of my 4 counties that I represent being over the 70% mark, my other 3 were drastically lower. And it's that, that lack of trust that, this vaccine is going to work for them, or signing up and getting their appointment bumped. Little things like that really, they kind of trigger people to feel that, well, we're not as important as your Lansing capital or your, well-to-do suburbs downstate. And so there becomes this natural, I guess, attitude kind of to boycott it. And again, the UP is 96% Caucasian. Detroit, the numbers shift the other way. And we still have those commonalities where, again, we typically are sometimes the last thought, whether it's roads or, building water and sewer lines, all the stuff like that. And so I think that naturally carried over into the pandemic. So it's been tough. I think, the best thing I can say is, especially as a diabetic, is, I did this to protect myself, but also, to protect others. So there's a lot of grassroots advocacy where I'm from, not necessarily down in Lansing in the legislature. This is more, something I have to do to get out and meet with local leaders and get into our churches and congregations and get out to those small places and really try and make a difference that way.
Okay, well, thank you so much. Senator Daly.
Okay, and Rep. Cambisi covered a lot of good issues. I think one of the, sometimes I like to be the guy that looks at the good that comes out of something. And I can tell you, we're going to look back someday at this pandemic and see that some of the good things, and one in particular is, telemedicine. And I think that we have expanded telemedicine across our state that is so important to people when it comes to the medical field. And that helps people in both ways. People that are afraid to come out of their homes can do that through telemedicine and can do things like that. So I think that's been a huge plus that came out of this, is the expansion of telemedicine. But we live in, the interesting part about serving in the legislature is like Rep. Cambisi, who's up in the Upper Peninsula. We all come from different areas. We all have to represent our people. We all have to get out there and do the best we can to help them out. And so I think that just being out there and being available to people is really so important.
Great. Well, let me ask you one more question, because Senator Daly, you mentioned telemedicine, And I'm not familiar with, access in the state, but how is access to technology, the internet and broadband in some of your rural communities? Is that good, or is that still a challenge for you?
It's obviously a challenge for us, and I'm sure it is in the UP as well. I started this back in my previous years before the state legislature. I've been a farmer my entire life, and in the community where I was in township government, it's a rural community. And we actually, when I was a township supervisor, we really wanted to try to get more internet access. And we put up a tower on our township grounds to provide Wi-Fi through a site type program. Of course, those don't always work because you've got hills, you've got trees, they won't go through trees and hills. With the company we were working with, a company called Air Advantage that did a great job for us. They ended up going into a nearby town and putting a tower on top of an antenna on top of a water tower, which I couldn't even access the tower that was at our township hall at my farm. And so at the top of my silo, I could see that water tower 7 miles away. So they came out and put an antenna on top of our silo, and we reached another 30. So we were creating that as long as that was about 15 years ago when we started that. And it's still a problem, and it's still an issue. And, we've got to figure out a way. And what the pandemic brought out more than anything is the ability for people to access through internet. So there's a lot of programs in the works, and unfortunate that we passed a couple that the governor didn't agree with. She vetoed a couple that we thought would work, but so it's still in the works, and we're still trying to get there.
All right. Well, thank you so much. Well, I have one last question for you both, and it is really around asking about the best ways that that our population of advocates can help you and work with you can help and work with and engage their own representatives. And sometimes we hear that just people writing a few letters will actually get attention. So we need some guidance from you in terms of how do we mobilize ourselves? How should we work with our representatives and senators?
I go back, I'm kind of old fashioned, and again, coming from a very rural part of the state, to me, the best is trying to get in on a one-on-one conversation. We get a ton of letters in our offices. We get a ton of phone calls that our staff mostly, they're the ones that deal with that, but we also have coffee hours every month. We are out in our communities. And to me, that is the best time when you have an issue that I'm able to give you my attention and really take note and listen to, what you have to say and why this is important. And again, with diabetes, I can tell you that just about every coffee hour I have still to this day, people bring up the importance of my bill and the importance of Kevin's bills and, how can we do more? So to me, that's my motivation, and that inspires me to make sure that this issue stays at the forefront. As legislators, we work on a wide variety of issues at any given time, but when you have advocates that, come to you and show up and they're there with you, every step of the way to fight to get something passed. I mean, that's how stuff gets done. So I would just say, yes, continue to organize and write letters and certainly reach out, but your legislators are out in your communities. And if you can make one of those coffee hours or one event, that's really where that connection happens. And I feel it makes the biggest difference.
Great. Well, thank you. And Senator Daly?
Yeah, and well, as I touched on a little bit, the reason I had these bills that involved insulin was because of those same office hours or coffee hours that the representative's talking about, because Tammy Martin and Jill Verdier are the two young ladies that came to one of those meetings. I remember it like it was yesterday, and they were advocating for this bill that I wasn't familiar with, the type 1 diabetes. I wasn't familiar with the program, and got to know them, took it back to Lansing. We stayed in contact and started working together, and it made it happen. So having that relationship, if you can, one-on-one. And the other thing is that don't be afraid. I mean, you can send letters. In my opinion, my personal opinion, the worst kind of letter you can send is a canned letter from an association that says the same thing that the other 500 letters you're getting say. But if you take the time to call or to write a personalized letter, you're going to get more of a personal response. And I would guess that Representative Cambisi, knowing what type of a representative she is, probably spends a lot of time on her phone on her short drive home from Lansing to the UP every weekend.
Yes.
But that's what I do. I go home every night, so I spend about an hour and 20 minutes going home in the evenings, and I spend that whole time on the phone calling people back. So don't be afraid to call your representative or your senator's office, and be polite, be nice. Don't call with a chip on your shoulder. That usually doesn't help. And you can get past that staff. I tell my staff to give me a list of names to call, and I'll call these folks back, and we just have a conversation, and usually it turns out really well. And so that's what my encouragement is to have a relationship, get to know them, and it might start out as a phone call, and then you might run into them in the local coffee shop someday.
Well, thank you so much for the great advice, the feedback, and again, Representative Cambisi and Senator Daly, thank you for all the work that you are both doing, and you can always count on us to be there advocating right along with you. And so with that, I will turn it back over to Julie.
Yeah, I also just wanted to say thank you. We know you guys work nonstop, just like you were saying, Senator Daly, on your drives home. We know that your time is short, and so we're really appreciative for you being here. And just one quick point, I love that you both aligned so well on this issue while having these different perspectives in your experience with diabetes. Representative Daly, you really set an example that you can be a strong diabetes advocate without having the disease. And this isn't second nature to you. It takes work to understand what people with diabetes go through. And we really appreciate your devotion to your constituents to getting the emergency access law passed. And it shows that it really is on us to respectfully educate lawmakers, because to someone who doesn't directly manage the disease, like Representative Cambisi was saying, there is a learning curve and a lack of awareness, and we have a responsibility to convey just that, and we're committed to doing that. So thank you. And Representative Cambisi, to be able to set an example for everybody on the call today of sharing your personal story by sharing yours is really powerful. And listening to you is such a touching moment too, for you to recognize, all those who, like your mom, are worried about someone they love or themselves as they work to manage this disease 24/7. So thank you so much for your good work on behalf of people with diabetes.
Absolutely, anytime.
Awesome. And we can have Ed, Senator Daly, and Representative Cambisi, if you could turn off your cameras and mute your mics, you're welcome to stay on for the remainder of our time today. Or if you've got other things you need to do, you're welcome to leave as well. So thank you so much again, and we will transition into the second part of our program today. Thank you. Well, that conversation sets us up very well for the next part, which is an overview on the state of Michigan politics. And we'll talk about the congressional delegation as well as the state process as well. And let's start with Congress. Like every state, Michigan has 2 senators elected every 6 years. And you can see representatives here as well. They are split down the middle perfectly, 7 Democrats, 7 Republican. And Michigan has a big advantage in the House of Representatives compared to most other states. However, like several states this year, Michigan actually lost a representative due to population changes with the 2020 census. So if you're not sure who your representative is, you can use the link at the bottom of the page to find that information. Next slide, please. One group in Congress that is really important for the patient community to be aware of is the Congressional Diabetes Caucus. A caucus is an informal group of lawmakers who have a shared concern or a shared interest on a particular topic. And they're often very bipartisan, which is a good indication, as we just experienced on the panel, that like diabetes should not be a Democrat or Republican issue. And notably, the Congressional Diabetes Caucus is the largest health caucus in Congress. We're really always really excited to share that. There are actually more members that are in the caucus than that are not. And it is bipartisan. It's chaired by a Democrat and a Republican. One of the asks you can make on our website at any time is to make sure that freshman representatives, so those are anyone who was newly elected in November 2020, join the Diabetes Caucus. And you have one here on the screen. So again, if you need to look up your member, you can use the link. We could put it in the chat to see that and send a letter through the Deepak website to encourage them to join the Diabetes Caucus. And Michigan does not have a state diabetes caucus. So that is, as you saw in the scorecard, an opportunity as well for extra focus and attention on diabetes in the interim. Switching over to state politics. So Michigan is one of 12 states where there is not a trifecta. And if it were, that would mean that the House, the Senate, and the governor's office would all be held by members of the same party. But in this case, a non-trifecta state, you see that those are different. The governor, in this case, is a Democrat, and the House and Senate majorities are Republican. Those majorities are fairly narrow, as you can see on the slide, in both chambers, which means that in order to override a veto by the governor, the Republicans would need some Democrats to team with them to achieve that 2/3 majority to override any vote. And Michigan legislators work year-round to pass bills, whereas in some states they have sessions that only last a couple of months. So legislators in Michigan have a couple breaks, including one that they're on right now, and also again in deer season, which is a very important week in November, as I'm sure everyone here knows. But they are occupied all year round, which means that we as advocates can also be occupied year-round working with them. And interestingly, Michigan is one of a handful of states with term limits. So House members are reelected every 2 years, and their term limit is 6 years, while senators are reelected, all of them, every 4 years, and can hold the position for 2 terms, so a total of 8 years. And as our legislative panel was just saying, legislators are coming to the Capitol with all kinds of issues in their mind, many of which will be very specific to the desires of their district or their region. And so it's, again, really important for us to let them know as constituents, the folks who are electing them to this office, that diabetes matters. And that motivates them to help legislation, or to pass legislation rather. And we're going to look into that process of passing legislation here in just a moment. So on this slide, you can see how a bill becomes a law, and it is not an easy process. You can see there that Bill is sitting on the page from Schoolhouse Rock to remind us that there are many bills that do not make it even past the first step, which is filing. So a bill is initially filed, but it may not move after that. It might die in committee. If it moves to committee, it might die on the floor if it moves to the floor, but there are all these steps. And the big takeaway here is that it's a long process. It requires a lot of patience from the advocacy community, and that each time you see those colored boxes change, that's a time when we can be effective advocates. We can talk to members of a specific committee that the bill is assigned to and ask them to vote yes or no. We can do the same when the bill moves to the floor in the House or Senate for full consideration. So we can ask the governor to veto the bill or to sign the legislation. There are a lot of opportunities for us to speak out, and Deepak will help to identify those opportunities and make sure that you're aware of them too. In part 2 today, we're going to transition into what the issues actually are. So when we are advocating, what are the bills and the issues that we're typically talking about? These are making the rounds in state legislatures across the nation, and we're going to have a panel to actually walk us through some of those. But first, we're going to talk about how to be a Deepak champion. And you've heard us maybe use this phrase already today. A champion is somebody who is an advocate within our community of advocates, who is doing more than maybe just somebody who's subscribing. That's somebody who's taking action, somebody like all of you today who are really intentional about joining an event where we have people who want to learn more about what's going on in their state or how to be an advocate. So thank you for that. And we really rely on our champions to be involved, to help their families and their communities, and also to get those same people to sign up to advocate. So we often ask our champions and would ask each of you to find 5 or 10 friends or people in your immediate community who can also subscribe to get alerts and calls to action when action is happening in Michigan or in Congress. And you'll see on the next slide, this community has people from every state. So we're really excited always to be able to have such broad reach across the nation. And here in Michigan, we're really proud as well to have so many advocates already in this network, and really excited for those of you who are new today to join our champion community. So again, that point at the end, how do we get these things done? And one way is by answering calls to action. And you see examples of that on this screen right here. We have a platform on Deepak's website so that anyone can participate in this legislative process, which again is not straightforward. It's challenging to do on your own. And that's why Deepak does the heavy lifting for you so that we can send out, action alerts with letters that you can send to your representatives, members of Congress, others with just the click of a button. And for alerts you can take, you can go right now to our social media. You see it here on this slide, and follow us and make sure that you're getting the alerts for your state and for Congress. So number one is take action here, and your inbox will not be flooded because there is not always a lot happening. There's a lot happening, but there's not always a point in which we can be active. But when we can be, it's important that we are. So it takes patience, right? Because it's at a government pace. And join us also for other events. We have virtual and in-person Hill Days, a virtual one coming up right around the corner that we're getting really excited to announce here in the next week or so. Policy briefings, we have events via social media, so please stay tuned and subscribe. And we'll go on to the next slide. Please follow our updates on ways to tell your story. We talk about this, and we talk about the why we advocate. Each of us has a reason. Representative Cambisi and Senator Daly shared theirs with us. And we want to make sure that that's one of the main points that comes through today, the why we advocate, to practice your story, practice telling a lawmaker why this matters to you, why do these changes have to be made. And it's a really good opportunity in these click advocacy settings to elaborate on what's there. So you see here, you have, for example, who comes up and based on your certain state or based on your congressional representative. It's automatically sent for you, but you can elaborate in that box about why this matters to you personally. And that makes a big difference in writing. It also makes a big difference when talking in person. And then lastly, we just want to talk about one of those calls to action that's active now. So you can write to Representative McLean and ask her to please join the Congressional Diabetes Caucus. Again, it's a way for lawmakers to come together in a bipartisan fashion and discuss diabetes. And we want as many legislators and congressional representatives as possible to join their respective diabetes caucuses. It doesn't always mean that they're going to take the action that we want them to, but it's the first step in really being plugged into what's going on in diabetes. And lastly, we just want to say thank you so much for attending today. Again, our social media is listed here. The next steps are listed here, especially sharing this with family and friends, because more people means more impact. And take action to tell your story. Your voice matters, your story is important, and we're so excited to be able to have this event in Michigan today so that we can be even more active in the state, especially as we see that good bills are happening, they're being filed. We expect to get a lot more check marks on that scorecard, especially with more champions at the helm. So thank you so much, and we will be sending you a follow-up email here soon with today's recording, next steps, and some other things we want you to see. Thank you so much.